what foundational knowledge or skills should the Indian student brush up before applying for US periodontics residency, especially coming from a different education system that you have mentioned right now?
So I think when the time comes for an interview, I think your question relates to what you need to brush up on when it's the time for the interview, right? Having gone through the initial stage of applying or giving the SOP, and then you're finally, there's a short list that's put up, and if you happen to be in the short list, then you obviously call for an interview. The initial interview might even be a Zoom interview, and then there might be an in-person interview. So that depends from the university to university. So to answer your question, what do you need to brush up? Actually, not much, because see, I have been on many interview panels myself. I've interviewed candidates who are applying for master's programs there. I also am adjunct faculty now at Tufts University. So having had exposure to the other side of the table, which is the interview side, I can tell you that, see, what one is looking for is one is looking for a candidate who knows the basics, but no one's going to ask you definitions of anything. No one's going to ask you, please define what is a periodontal probe. It doesn't matter. What matters is you applying that information, problem solving. So this is again one other big thing that a lot of the Indian schools seem to lack is problem solving, and that's what's going to help you in real life. So what I would do is I would ask the candidate, okay, this is a problem, which is a clinical problem. How would you solve it? How would you go about doing it? So I'm not concerned about whether you know chapter number 10 of Glickman by heart. Doesn't matter, because you will be going through it anyway in your residency program. What I'm concerned about is, do you know your fundamentals? Do you know where, let's say, what is the innervation of the maxillary artery? Because tomorrow, if there's a bleed and I need you to stop it, how will you do it? So fundamental things, nothing which is extraordinary. So you don't need to actually, if you've gone through all 4 years of your BDS and you've done reasonably well, you actually don't need to brush up anything. What you need to do is you need to strengthen your CV with other things, like I said, like publications, for example. So if you have a publication, I might ask you, describe how you went about doing the study. What was the statistical parameters that you kept in mind? Things like that. I mean, those are things which are important. Or I might ask you to analyze a particular research publication that I give you and tell me what it lacks. So what are the flaws in that research in that research publication? So these are things which you need to know as a BDS student. And these are maybe some of the things that are still not taught in Indian schools. So that is what I would brush up on.
So are there any scholarships that Indian students can apply for the US programs in periodontology?
So not just periodontology, most specialties, the top schools will have some sort of financial aid. Okay. And unfortunately, it's only the top schools that have it. So you need to have a good CV to be able to get through. So let's talk about two things. One is scholarships available here in India to go to the US, and scholarships available in the US. So let's look at the first one. So if you're a student who's applying from here, you actually have foundations like the J.N. Tata Scholarship. You have the K.C. Mahindra Endowment Trusts. So, for example, when I went, I was a J.N. Tata scholar. So I got a scholarship from the J.N. Tata Endowment, which is a fairly prestigious endowment trust to be a part of. And that covered some bit of my education. You also have the K.C. Mahindra Foundation, like I mentioned. You have the Gokhale Trust. There's actually a lot of them here, which you can apply for. Those lists are available actually on Google. If you Google them, you'll get to lists, and the application process is also online. So it's very easy to apply. Again, having been part of some of these interview boards in some of these scholarships, I can tell you that what we are looking for is what besides BDS, what have you done to prove yourself? You can't just have a CV that says BDS full stop. It's not going to fly. That's one thing. Now, about scholarships in the US, the best scholarships to get, of course, are some things like a research assistantship or a teaching assistantship with some of these top programs will have. Now, how do you identify some of these top programs? Again, go to the ADA website, the American Dental Association website, and each college or each program, it'll say, financial aid provided, yes, no. So if you want, you can only apply to the ones that are actually giving financial aid. And it'll also state whether financial aid is available for international candidates or is it only for US citizens. So it's all very, very clearly available and printed. And then beyond that point in time, of course, then, once you apply, then you go through the application cycle and take it from there. So scholarships are available. It's a myth that you need to be absolutely stinking rich to go there and study. I, for example, went and got 3 master's degrees. I got 2 master's degrees and did my periodontology residency at the same time. And I had scholarships all through. I didn't spend too much from my own pocket at all. So it's very much possible to do it, but you need to have a good CV to do it.
International students practice periodontology independently after they complete the master's, or do they need a further examinations to write?
So there are two different things to bear in mind. A degree in periodontology or a residency in periodontology from the US does not give you licensure by default. There's a separate licensure exam which you need to give if you want to get a license. So there are different boards, licensure boards, like the Western Regional Board, the Northeast Regional Board. So these will have their own separate licensure requirements, but having a specialty residency degree from there gives you the right to give that licensure exam. Okay. So that's how the licensure process works. Now, you could, at any point in time, work as a faculty within a university without giving a separate licensure exam because you're given what is called a faculty license. You can get a faculty license if you're hired as an employee after doing a residency program, a master's program, in which case you don't have to give a separate licensure exam. However, if you want to practice independently, let's say in a clinic or whatever, then you will need to give a separate licensure exam, and then you will need to get a separate visa to be able to work in that independent unit. So it's definitely very much possible, but these are two separate pathways that you need to explore.
So what about the visa pathways after completing the MS in periodontics? How do we
So
go about it?
So if you want to work post your residency training, you will need an H-1B visa, which is the work visa. The good news with the H-1B visa in the US is it doesn't come under what is called the H-1B cap. So the IT people, for example, it comes under an H-1B cap. There's a certain number of visas that are given for IT people. We don't fall in that. So you will get an H1B if the university gives you and you accept a job offer. As regards working in a private clinic, the private clinic then needs to be your sponsor for that visa. So that can be a little bit more tricky because they may not want to spend that extra money to process that visa, whereas a university will readily do that. So you definitely would need a work permit, a work visa to be able to work in either scenario. And that is very routinely done if you have that particular paperwork in place.
So do you think doing MS in US opens better opportunities in terms of research, clinical practice, or academia compared to India?
The short answer to that is yes, I think it does. Okay. And the reason is a couple of things. Number one is it encourages you to think beyond the textbook. Okay. So that's one. Second is you do have access to very good infrastructure within that dental school. Now, having said that, I can tell you that now India is also very, very different than what it used to be 15 years ago. So in your city, in whichever city the person is, there will be IITs, there will be an Indian Institute of Science, there'll be an ISER. There are so many world-class institutes in India which are not in dental colleges or dental schools. But what is stopping you from going there and doing stuff? Nothing is stopping you. It's just that students often don't take the initiative of doing it. They just want a degree and that's the end of it. Uh, in which case, it's actually the student's fault, not the college's fault, right? But what I also do see is that there are a lot of people, churning out, getting churned out with degrees who actually don't know much. So, for example, when we conduct continuing education courses in India, we see that there are candidates who come who you would expect to have a certain fundamental knowledge base with a particular degree, and oftentimes that's not the case, which is a problem because they are going to go out into the real world, and if they don't know their particular USP, they will have problems getting patients and giving the best of care to patients and hence developing good practice. So, to answer your question, yes, I think um, at an average level, an average US dental school will probably give you more opportunities and more exposure compared to an average dental school in India. But the top schools in India, which have other things around them, may actually be comparable. But it comes down to the student to look at those options which are there and do something out of it, do something and explore and use those opportunities. So it's not, so things have changed. It's not that India is the India that it used to be 15, 20 years ago. It's advanced, it's progressed. We have institutes with cutting edge technology. I mean, for example, I'm based in Pune. We do a lot of work with ISER, the Indian Institute of Science Education Research, and we are one of the first and few entities in India that have clinical research grants from Europe and US, and we do stuff here. So it's not that it cannot be done. It's very much possible. It's up to you to utilize those options and do something from it.
So, what advice would you give to an international student who is still unsure if they should take US route for periodontics?
The one advice is if there is an opportunity for that person to travel to the US before and see things, it actually would help. Because sometimes, we imagine some things and they don't, actually be uh, the way your imagination uh, has sought them. So, if that opportunity arises, if that exists for any individual to travel and maybe spend a week or 2 weeks there, that would be my advice, number one. Number two is if that is not possible, let's say, to start a dialogue with some faculty there who will match the interest that you have. And faculty are very approachable. They will certainly be very approachable, helpful. They will certainly try and give you, their own 2 cents about that particular place. So these are some of the outreach things that students certainly should do. And emails are available on whichever college's website. It's very easy to contact faculty. So these 2 things are suggestions that I would have. And of course, number three is try and do something besides your BDS because it will also open up your eyes to what is possible. Maybe you have other interests that you yourself have not explored. So these are the 3 suggestions that I have. Now, for example, I'm on Instagram. Anyone can look me up and approach or send a message. So similarly, you can approach faculty in most universities. But again, for someone to help you, you need to show that there is some commitment, some dedication, some particular interest that you have. Only then is someone going to help you, and that you have done your background work. Now, if someone asks me a question that I'm a BDS student, I want to apply, how do I go about it? I will say, okay, go to the ADA website first. Have you done your research? Have you done your bit before asking me? Because a lot of information is available on Google these days. So if you're expecting faculty or anybody else to spoon feed you, that's not going to happen because people have their own busy schedules. But if you have specific queries after you have done your background research, I think most people are very helpful. They will help.
So, thank you so much for taking your time to share your remarkable journey and valuable insights on pursuing masters in periodontics in US. Your experience from navigating multiple advanced degrees to becoming the first diplomat of American Board of Periodontology, who's actually practiced in India, is quite inspiring and also incredibly informative. I'm sure your practical guidance and application preparation and clinical training differences, and also the long-term opportunities that you have told in this interview, would definitely shed a light on the path for many aspiring dental students. I'm especially grateful. My team is grateful for your openness in discussing both the challenges and the rewards of the international route. I'm sure this conversation will undoubtedly serve as a trusted resource for students who are looking to follow your footsteps, which I know wouldn't have been very easy. So, wishing you a continued success in your practice and academic opportunities, sir. Thank you once again for your time and generosity. Thank you, sir.
No, and Anisha, thank you so much for taking this opportunity of getting this together because I think information dissemination is so important and you're doing a wonderful job with that. So thank you.